Today, I'm going to tell you 5 reasons why you do not need a chiropractor to treat your back pain. And if you give me a second to explain after you have heard that, I will also tell you why you don't need an orthopedic surgeon either. Stick around to the end of the video to find out exactly what I do think you need to deal with your back pain. And trust me, it isn't drugs or surgery. If you type chiropractic into the search bar on YouTube, you will find a myriad of chiropractors of all types on this platform. For whatever reason, chiropractic therapy is very popular on YouTube, and there are quite a number of famous chiropractors that do very well with their content. Several of you have sent videos to me for review, and I have either created content that critiques the techniques that I have seen or that discusses the relationship between chiropractic therapy and orthopedic surgery. But that is all rather general in nature. Today, I want to tell you why the average person does not need a chiropractor, or at least chiropractic manipulation, despite what they might tell you to treat their back pain. Now, don't get me wrong, I am not telling you not to go to a chiropractor. That's your business. But after listening to this video, I hope that if you go to a chiropractor for spinal manipulation, you will understand that you are just as capable of addressing the back pain on your own without manipulation as you were when you went to have them crack you. Having said that, here are 5 reasons why you do not need to see a chiropractor to treat your back pain. Chiropractic manipulation is a form of symptom management. In other words, chiropractic manipulation treats the symptoms and not the pathology. It's like taking a Tylenol or having a hot shower. It speaks to the manifestation of the problem, the pain, but not the thing that caused the pain itself. This is why you feel good after leaving the chiropractor, but then shortly afterward, your symptoms return, making it necessary for you to return to the chiropractor for additional treatment. Had the pathology or problem been addressed by the treatment in the first place, then repeat treatment would not be necessary. Now, I know that the chiropractors will say that they are correcting subluxations of the spinal column, which leads to all sorts of problems. But the concept of spinal subluxations as used by chiropractors is an outdated concept that has not been proven or confirmed by study. And before you get all hot and bothered that I simply don't know what I'm talking about, let me say this. Science is the tool that we use to confirm or deny what we think is true is actually true. If chiropractors think that subluxations are actually a thing of consequence, the onus is on them to show that it is that with adequately designed, peer-reviewed study. They have not done this so far, and the medical community is still waiting. Yeah. Now, if you discount the idea of subluxations as a form of pathology, then what exactly are the manipulations treating? The vast majority of back pain is what physicians call mechanical back pain. This term refers to pain that does not have a structural or a neurological cause. This basically means that your back isn't broken or dislocated, or you don't have a spinal tumor or infection, or you don't have a pinched spinal nerve or a compressed spinal cord. It refers to back pain that is associated with muscle spasm, muscle imbalance, muscle sprains, or even segmental joint discomfort that is caused by degenerative disc disease, repetitive use, poor posture, musculoskeletal injury, or general deconditioning. Put simply, your muscles are either too tight, too weak, too strained to appropriately stabilize your spine at rest or when moving. Pain is the language that your body, and in particular, these muscles, use to communicate to you that they are either tight, weak, or working outside of their performance envelope when called upon to stabilize your spine. Chiropractic manipulation is like earplugs that don't allow you to hear the painful message that your body is trying to communicate. But without addressing the underlying problem that caused the pain, the message is still there, loud and clear, the moment you take the earplugs away. That's why they give you homework or exercises to do at home in between sessions. That's what really treats your problems. The exercise is what really treats your problems. Which leads me to reason number 2. Chiropractic manipulation is a passive modality. A passive modality is a technique that is used by someone else on you while you do nothing other than receive the treatment. As mentioned before, the mechanical back pain that you experience is not the problem itself, but rather the message your body uses to alert you to some other problem. Your task is to acknowledge the message, decipher what it is telling you, and then treat the underlying problem that is causing the symptoms you are experiencing.
Hello?
If your muscles are too tight, this means that you will stretch the affected areas over time and develop more flexibility. If they are too weak, it means that you will strengthen them over time and develop better ability for them to deal with the task that you impose. If they are poorly balanced with their opposing muscle groups, you will develop your proprioception to allow you to improve your body mechanics and mobility. In each case, there is an underlying problem that you, and only you, must correct to eliminate the driver of the pain symptoms. Chiropractic manipulation cannot do this. Chiropractic manipulation cannot restore strength or flexibility, nor can it restore proprioceptive function or mobility. Only the affected individual can do that through hard work over an extended period of time. If you have a hole in your roof and you simply paint over the water stains on the wall where it was leaking, your wall might look pretty. But the next time it rains, guess what's happening? Chiropractic manipulation does not engage the patient to be actively involved in their cure, and it does nothing to empower the patient to care for themselves. Reason number 3. Chiropractic manipulation is no better than physical therapy. That's right, you heard what I said. Chiropractic therapy, when compared to physical therapy head to head, is not more effective. While small studies have shown that chiropractic therapy is better than doing absolutely nothing, it is not better than doing conventional therapy, despite what your chiropractor may tell you. This means that chiropractic manipulation is not required for the resolution of mechanical back pain symptoms. Period. No study has shown this to be true. So if it is not required, why do it? And why charge you for it? If you want to do it because it feels nice like a massage, then so be it. But you should not be left with the impression that it is actually doing something to your spine or that it is in any way a necessary part of your treatment. Cracking your back is like painting the wall in your living room while your roof is leaking on your head. You can do it, but does it make any sense? Isn't it more straightforward to just fix the roof or just address the problem causing the pain directly? You are just as equally served by going to a physical therapist to undergo a regimen of active progressive exercise therapy, because that is what you really need. In fact, if you had the requisite knowledge, you could skip the therapist altogether and treat the problem yourself. Any therapist, whether they are a physical therapist or a chiropractor, if they are treating you with an evidence-based practice or one that is based on the results of a peer-reviewed study, should use exercise as the foundation of their treatment of your back pain symptoms. Your treatment should be almost entirely based on exercise, and it should be indistinguishable from a workout at the gym. Cracks don't make you stronger, more flexible, more resilient, or less prone to injury, but neither do TENS, ultrasound, cupping, massage, or acupuncture. Only exercise can do that. All the rest is window dressing. If your therapist, chiropractic, or physical does not have you doing exercise for the duration of your session with them, then you need to find yourself another therapist. Reason number 4. Mechanical back pain, which includes the vast majority of back pain that people present with, has a natural history of self-resolution within 4 to 6 weeks. This means that if you did nothing at all to treat the back pain, nothing at all, for almost every person it would get better on its own within a month to a month and a half. Doing nothing. So really, the only reason to seek medical intervention of any kind is to expedite the resolution of the symptoms, for which chiropractic manipulation offers no advantage over conventional therapy. And arguably, when you look at the long term, chiropractic manipulation is less advantageous since, as discussed above, it treats only the symptoms and not the pathology, thereby leaving the patient just as tight or just as weak, or just as proprioceptively naive after treatment as they were prior to it, which may be the point. If you have only treated the pain and you haven't eliminated the pain generator, you have a situation where the pain is likely to return. and then you have to return to the chiropractor for more treatment because your symptoms came back. And on, and on, and on.
Dr. Chris, you're giving away our secrets.
Now, I am not saying that all chiropractors knowingly take advantage of this fact, but you can see how it isn't bad for their business, no? Which leads me to another point. Remember that the majority of cases of mechanical back pain get better by themselves in less than 6 weeks? This means that if you are receiving chiropractic manipulation for more than 6 weeks and your symptoms don't get better, your treatment is almost worse than you do nothing. Yeah, I can hear you saying, "Told you something is wrong with me. I knew it all along." But that too would be wrong. Studies still indicate that even then, the natural history of back pain is still quite favorable overall. While 1/3 to 2/3 of patients recover within 1 week, almost 90% recover within 6 weeks, and 95% within 12 weeks. Relapses occur in up to 40%, so this speaks to the importance of active progressive exercise therapy in the treatment of mechanical back pain. You actively have to do something to yourself to make your back pain disappear for good. And that doesn't mean getting up and walking into the chiropractor's office to get cracked. And finally, reason number 5. As I mentioned above, subluxation in the manner in which chiropractors use it does not exist. It is an outdated concept. The International Chiropractic Education Collaboration, comprised of 10 chiropractic programs outside of North America, has stated that they will only teach the concept of subluxation in a historical context. Vitalism and the proposed vertebral subluxations that are believed to cause most disease are the reason for which spinal manipulation was invented. The theory suggests that slightly displaced vertebrae interfere with nerve vibrations, a supernatural vital force, thereby causing disease. Adjusting or repositioning the vertebrae is believed to remove the interference with the body's innate ability to heal itself. But of course, this ridiculous word salad has not been demonstrated in any study. It is untestable. How convenient. After all, there are so many questions to answer here. What is slightly displaced? How is displacement measured? What nerve vibrations are interfered with? How much interference with these vibrations is sufficient to cause disease? Does less interference cause less disease or a milder form of disease? Does more interference cause more disease or a worse form of disease? Have these nerve vibrations been demonstrated or measured before? How are the vertebrae adjusted? How much vertebral adjustment is required to cure disease? Does less adjustment cure less disease or only mild disease? Does more adjustment cure more disease or worse disease? What particular innate healing ability are they talking about? Which biological pathways do these healing abilities correspond with? There are so many questions here that there are a bazillion opportunities for research studies to demonstrate the truth of these concepts and to provide the answers we are waiting for. However, oddly, there are not any studies to provide this information. So I think it is safe to say that there probably is no evidence to support these ideas. But if these ideas are the basis for the spinal manipulation technique, doesn't that then mean that there is really no scientific basis for cracking your back? But if these ideas are the basis for the spinal manipulation technique, doesn't that then mean that there is really no scientific basis for cracking your back? Snap! Well, isn't that awkward? Let me assure you that for the vast majority of people, there is nothing wrong with your back, even despite the back pain that you transiently have. And you do not need a chiropractor to crack your back to realign you or to put anything back into place. That is complete and utter BS. You are normal, and intermittent back pain is a normal part of life that does not have a serious cause in most of you. So now that I have established that you don't need a chiropractor to manipulate your back to treat your back pain, let me tell you why you don't need a surgeon to fix your back pain either. Let me assure you that drugs or surgery are not generally required for almost everyone watching this video to treat mechanical back pain or neck pain symptoms. Reason number 1. Most cases of mechanical back pain are self-limited and don't require surgery since the cause of the pain is minor. 95% of patients resolve within 3 months and only 5% are a result of more serious problems that require additional medical treatment. Reason number 2. Back pain is generally not an indication for surgery. As surgeons, we primarily care about leg pain, leg weakness, or loss of sensation or function in the lower extremities. These findings tell us that nerves or the spinal cord have been compressed by bone, disc materials, tumors, or something else higher in the back. Surgery can be used to decompress the squished structures and stabilize the spine around the site of the injury. Pain, on the other hand, is a nebulous idea. Everyone experiences pain differently, and the causes of back pain vary. So there is no single procedure that can be done to stop back pain. Number 3, surgery is an invasive procedure that requires us to cut into the body. It is associated with higher risk and more complications than non-operative treatments, such as chiropractic therapy. It should be considered only after you have exhausted all other non-operative treatments such as activity modification, medication, therapy, physical or chiropractic, massage, or bracing. If you haven't attempted these treatments first and failed, then we usually don't consider you a surgical candidate. Surgery is inherently risky, and we want you to rule out less risky options before surgery is considered. Number 4. Because 95% of back pain is self-limited and caused by minor issues, usually only reassurance, education, and active progressive exercise therapy are required to treat the majority of back and neck pain problems. Basically, 19 out of every 20 back pain patients require only exercise. And reason number 5, findings that are present on MRI often do not correlate with symptoms that patients complain of. Many of the findings are also present on normal people who do not have back pain. Just because a finding was present on an MRI does not mean that it is the cause of the patient's pain, nor does it mean that surgery is required to address that finding. Surgeons don't treat imaging findings. We treat loss of function that is caused by structural problems. That's it. So, if you don't need chiropractic manipulation or surgery to treat your back pain, then how do you do it? Generally, back pain can be effectively treated with a staged approach geared toward the phases of the pain. Acutely, when the pain is most severe, patients can start a gentle movement program, such as the McKenzie method, to address initial muscle spasm and to facilitate more active modalities. The McKenzie method has been shown to improve short-term outcomes for back pain. Subacutely, once pain has begun to subside and the patient is more mobile, an active progressive exercise program that focuses on movement and flexibility of the spine and strength of the core, back, and lower extremities is utilized to restore baseline function. After recovery, a similar exercise program can be used for maintenance to prevent back pain from recurring again in the future. If you receive the assistance of a therapist who is practicing using evidence-based methods, then whether they are a chiropractor or a physiotherapist, they should be indistinguishable from one another. So, that is why, for most people, you don't need a chiropractor or a surgeon to treat your back pain. Thanks for watching and subscribing.